And a journalist is raising awareness about the importance of colon cancer screening, taking us behind the scenes of his own screening process. Nicholas St. Fleur says colon cancer runs in his family, and the death of Chadwick Boseman inspired him to take action, not only for his own health, but also to call attention to the increased risk for black men. TJ Holmes has more.
Wakanda forever!
The death of Chadwick Boseman, inspiring one reporter, Nicholas St. Fleur, to take action.
We are performing a colonoscopy.
Colorectal cancer is the third leading cause of cancer-related deaths in men and women in the U.S. So St. Fleur decided to show just how important, but also how easy it is to get a screening.
My mother had colon cancer at the age of 34, so I knew that I was at a higher risk to develop the disease myself. So once I saw that Chadwick Boseman passed away from colon cancer, it really kind of sparked me, and it made me realize I need to be more serious about this, about getting checked myself.
St. Fleur documented his colon cancer screening from start to finish.
I wanted to help fight or combat any stigmas associated with it, because it is such a personal part of your body, and it is something that many people don't want to go through because they might find it scary.
Doctors are seeing a spike in colon cancer rates among young adults, and currently screenings are recommended starting at age 45 and younger if you're at higher risk, like St. Fleur.
It is going to become the top leading cause of cancer death in people aged 20 to 49 by the year 2030. There is a stigma around talking about colorectal cancer. So my hope is that the conversation around this cancer becomes more normalized and that people understand what a prevalent cancer this is.
Colorectal cancer is even more prevalent for Black Americans, who have a 20% higher chance of getting the cancer and also are 40% more likely to die from it than other groups.
I knew I had a family history, but I didn't realize that as a Black man, I was at higher risk as well.
The social environment in which you having your race plays itself out in ultimately leads itself in towards affecting your actual health outcomes.
Doctors say catching it early is the key to survival.
The screening tests are very effective, and they are actually not that bad. It is also important to convey that there are very easy at-home stool tests that are very easy to do.
All right, TJ Holmes, thanks for that report. And joining us for a little bit more on this, ABC News medical contributor and emergency medical physician Dr. Darian Sutton is here. Dr. Sutton, thanks so much for joining us. You know, we heard there in TJ's piece that colorectal cancer is going to become the top leading cause of cancer death in people 20 to 49 by the year 2030, according to cancer.org. And my own family has had experience with this. So I wonder, why are we seeing a spike, and why isn't this talked about more?
Well, thank you, Diane, for involving me in this. I think this is an incredibly topic to discuss, as we've seen, and specifically younger age groups, those under the age of 50, are increasing their rates of incidence of colorectal cancer diagnosis. And scientists are trying to understand why exactly this is. We want to hope that it's secondary to the advanced screening techniques that we're using, but there's also some theories that there is environmental effects, including diet changes and sedentary lifestyles, that increase one's risk of developing colon cancer.
And so how do we get this into the conversation more? Because it feels like one of those things that people are embarrassed to talk about.
I think it's exactly that. I found when I'm talking to patients about the signs and the symptoms of colorectal cancer, it's often seen as a taboo topic that many people find really, really difficult to talk about. And I can understand exactly why. I'm also human. I also see a physician myself, and I find that level of discomfort. But we need to break through that in terms of providing more accessibility and communication and awareness around this disease so that we can find this problem early, as was stated before. Early detection would help prevent late onset disease.
Now, this type of cancer is even more prevalent for Black Americans. We heard TJ cite the stats there, 20% higher chance of getting colorectal cancer, 40% higher risk of dying from it than other groups. Why is that, and what can be done about that?
So I think in order to attack this important issue of the disparities in outcomes, not just in the diagnosis, but also Black Americans are up to 33% less likely to receive appropriate screening and referrals for colorectal cancer. So we need to address this from all efforts, not just the community and the community awareness and education, but also making sure that access and affordability of healthcare is possible. And then, of course, acknowledging the bias and systemic racism that affects patients within the exam room. I think if we begin to acknowledge all all of these efforts, then we can hopefully decrease the disparity that we're seeing today.
So what are symptoms that people should be looking out for, and what are some measures that we can take to try to catch this early?
So I try to help patients first understand the history. If you have a past medical history of irritable bowel disease or other colonic infections or diseases, then you need to make sure that your physician and provider understands that, especially family history. Those who have a direct family member who has been affected by colorectal cancer are at increased risk of colorectal cancer, and those patients often need screening earlier on. And then symptoms. If you have a persistent change in your bowel habits, if you notice that you have any associated bleeding or any new concerning signs or symptoms that are associated with your GI system, you should bring these up with the provider.
All right, Dr. Darian Sutton, it's great to have you as always. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.